All right. Hello, everybody. Oh, the numbers are rising. I am Dr. Ted Barnett from Rochester Lifestyle Medicine Institute, and I'm going to wait for everyone to arrive. We have over 300 people registered for tonight's incredible lecture. I'm so excited, and looks like it's climbing steadily here. So I'm just going to wait another minute while people are able to get into the room from the waiting area. So. All right, good. So welcome everybody to Rochester Lifestyle Medicine Institute's lecture, Lifestyle as Medicine lecture series. And I'm so excited that tonight we'll be having a presentation with Brenda Davis, who is a famous registered dietitian. And I will be telling you more about her, but there is the title of her talk, Debunking Keto, Paleo, and Other Low-Carb Diets. And if Brenda, if you could just turn that slide off for just a minute, unshare your screen. I'd just like to tell everybody a little bit about Rochester Lifestyle Medicine Institute. We have been around since about 2015. We are a 501c3 nonprofit, and our mission is to bring plant-based nutrition to the planet. In fact, look, there's a little logo there with some green leaves overlying the planet, so we mean it. And we meant it back in 2015 when we came up with that logo. Anyway, one of our really exciting programs is our 15-day whole food plant-based jumpstart, which right now we're in about our 34th. We do it every month. We've had just about 1,000 people go through our jumpstart so far. And I'd like to introduce Dr. Susan Friedman. Susan, can you unmute yourself and say hello? Yeah.
Hello.
So Dr. Friedman is a professor at the University of Rochester and a geriatrician, and she's a professor in the Department of Medicine and lead author on a recent white paper from the American College of Geriatrics. Did I get that right? It's ACG, right?
American Geriatric Society.
Oh, American Geriatric Society. Thank you for correcting me. Yeah, and so Dr. Friedman and I have been working hard at putting together a 15-day jumpstart, and we're really proud of it. And I'm really excited to work with Dr. Friedman, who is our director of clinical studies, and we just recently published a paper. What was the name of the paper? Not to put you on the spot or anything, but jumpstarting
like
your health.
Jumpstarting your health with
yeah,
whole food plant-based nutrition.
Excellent, you got it.
Don't quote me on that.
Yeah. Anyway, yeah, it was just published in the American Journal of Lifestyle Medicine, and so we're excited about that. And let me just mention a couple of things. If you have questions, please put them in the Q&A. I know a lot of people are entering things into the chat right now, which is fine. We'll try to look over there as well. But we actually, because this is a webinar format of Zoom, we have a Q&A button at the bottom of your screen or wherever that happens to be on your particular screen.
We already have a fan note. Greetings from Puebla, Mexico. I'm a super fan of this great dietitian. Just wanted to put that out.
Okay. Oh, excellent. Thank you. Yeah, fabulous. Well, I think that's a good reason to bring our guest on now. So, Brenda Davis, Ms. Davis, where are you? Show yourself. So, Brenda Davis is an extremely well-published author, and oh, there she is. Hello, Brenda.
Hi, and hi in Mexico. That was so sweet.
Yeah, and you're all the way up in Calgary, Canada, so you must be several thousand miles apart, at least.
Yes.
So, right, but still in North America. So
that's right.
I'm sure we'll be getting some people from other continents at some point tonight. So your most recent book is called Nourish, the definitive plant-based nutrition guide for families. So there it is. Yeah,
Here it is.
Yeah, and so if you want to hear more about that, Brenda was on
Rip Esselstyn's.
Rip Esselstyn, thank you. Rip Esselstyn's podcast, if you want to hear that, along with her co-author, Reshma Shah. They had separate podcasting events, and so it's really fun to hear that. And I've known Brenda for a long time. We go way back because we've been going to North American Vegetarian Society meetings since the 90s, early 90s. And I'm just so excited because you've done work in the Marshall Islands. Are you going to be talking about that a little bit tonight?
Not tonight.
Oh, okay. All right. Oh, look, someone says, and I'm in Canada too, Cape Breton Island.
Oh,
Susan,
wow.
anything? Yeah, that's cool.
Ah,
Yeah. So very nice.
fellow
Yeah.
Canadian.
More Canadians. Exactly.
Covering a lot of ground here.
Yeah. And two other really important books that Brenda has written. One is Kicking Diabetes Essentials and the oh, there we go. Kicking Diabetes
Kick Diabetes Essentials
Cookbook.
and
Yeah.
the cookbook.
Yeah.
Yeah.
I mean, one of the most amazing, I mean, not to put you on the spot, Dr. Friedman, but we have been seeing some amazing results with people with diabetes, right? It's just phenomenal.
It's
So,
the most, I think it's one of the most reversible of all of the diet-induced diseases for sure.
Yeah. And if people are interested in going to our website, actually, we have something called the Diabetes Bill of Rights. It's under resources. And the American College of Lifestyle Medicine just published the Diabetes Bill of Rights. And it's really, really an important resource, basically talking about the fact that we don't tell people what they should know about diabetes, and the fact that they don't have okay, somebody's correcting me. Absolutely right. It's not type 1 diabetes is not reversible.
No,
Thank
we're
you.
Definitely talking about type 2 and apologize for that, for sure.
Apologize for that. Exactly. But Brenda and I are on two committees of the American College of Lifestyle Medicine, and one is on the expert panel, and the other is the diabetes reversal. What's it called?
It's the Diabetes Remission Consensus Committee.
Right. But also we're on the task force. That's another committee as well.
We are.
Exactly. Right. So anyway, I've been floundering around here enough. I think it's time for Brenda to share her screen, and Susan and I are going to go dark now, and then we're going to see you all for Q&A after Brenda's presentation. Thank you so much, Brenda.
Oh, well, thanks so much for inviting me. And I'm just so excited about what you're doing in Rochester. You've certainly set an example for many other facilities that are even just considering a wellness program. So thank you for what you're doing. And I am excited tonight. Thank you all for being here, for taking the time on a Sunday evening to join us. My topic tonight is debunking keto, paleo, and other low-carb diets. So let's start with a quick outline. We'll begin by defining keto and paleo diets and talk a little bit about their distinguishing features. And then we'll move into addressing the claims made by the keto and paleo communities and the evidence or lack thereof for those claims. And then we'll delve into plant-based versus low-carb diets, and we will conclude by looking at the good, the bad, and the ugly where low-carb diets are concerned. So let's start off with definitions. So first of all, what is a ketogenic or keto diet? Well, it's essentially a diet that generates ketones. Keto equals ketones and genic equals generate. So it creates a metabolic state called ketosis. And that all ketosis means is that you have elevated ketones in your blood and urine. And so what are ketones? Well, ketones are acids made by the liver from fatty acids. And this is not something that is unusual in the body. We are always constantly producing ketones as an energy source for the body. But production ramps up hugely when you're deprived of carbohydrates or glucose. And ketones, actually, this is something that's really important. They can't be used by all cells. Only about 50% of your basal energy needs and about 70% of your brain energy needs can actually be met by ketones. Some cells can't use ketones at all, and they have to use glucose for energy. For example, our red blood cells lack mitochondria, and mitochondria are necessary for using ketones. And liver cells also lack a necessary enzyme for using ketones called beta-ketoacyl-CoA transferase. So not all cells can use ketones. So what triggers ketosis? Why would somebody go into ketosis? Well, there are actually three main things that can trigger ketosis. Number one is uncontrolled diabetes. It occurs mainly in people with type 1 diabetes, and it occurs when insufficient insulin is available. And it can cause a very severe form of ketosis, and it's actually potentially life-threatening, called ketoacidosis. And it's rare in people that don't have type 1 diabetes. The second thing that can trigger ketosis is starvation or fasting. And so when you have no access to food, your body starts to draw upon its carbohydrate stores. And so we store some carbohydrates in the form of glycogen in the body. And so we convert that glycogen into glucose for energy. And most people have maybe 10 to 18 hours of glycogen stores, and then they're done. And then we move on to using protein stores for a while, and protein basically from muscle, and we use it to make glucose via something called gluconeogenesis. And then thirdly, we start to rely on our fat stores. And basically what happens is fatty acids are broken down, and the glycerol that's tied to the 3 fatty acids and triglycerides is used to make glucose via gluconeogenesis. And the fatty acids then are used to make ketones. So that's when, it's probably at least a couple of days before we get into full-blown keto formation. And then the third thing that can trigger ketosis is, of course, ketogenic diets, which is what we'll be talking about mainly here. And these are basically eating plans that force the body to shift from using its preferred fuel, which is glucose, of course, to using its emergency backup fuel, which is ketones, as a primary fuel. And it's really, a ketogenic diet is a way of tricking your body into thinking it's fasting. And the diet is very low in carbohydrates, very high in fat, and it's low to moderate in protein. And the basic premise, the reason why people tend to go on these ketogenic diets is basically they believe that when they're in ketosis, they're going to shift to a fat burning metabolism, and weight loss will just become effortless, and disease risk will be dramatically reduced as well. So let's look at what exactly a ketogenic diet is. Well, it is first of all, there's a classic ketogenic diet that we've for many decades used to treat epilepsy. And that diet is only 2 to 4% of calories from carbohydrates. It's about 90% of calories from fat and about 6 to 8% of calories from protein. So the new sort of ketogenic diet that's become, become popular as a weight loss diet is a little less extreme than the sort of classic ketogenic diet. It's usually about 5% of calories from carbohydrates, but it can go as high as 10%, about 70 to 80% of calories from fat, and about usually somewhere 15% or so calories from protein. So what foods are permitted? Well, you can see this sort of keto pyramid here. The base of the pyramid is meat, poultry, and fish. And then you see cheese and eggs and butter and oil. And then going higher on the pyramid, some non-starchy vegetables, nuts, seeds, and berries. And you can see from the bottom that there are no grains, there are no legumes, and no fluid milk included in this diet, although cheese is included because fluid milk's a little higher in carbohydrates. And the slogan you'll often hear, or the theme, is to eat fat, eat meat, poultry, fish, eggs, the fattier the better, eat non-starchy vegetables. And that's kind of the diet. Here's a sample recipe I took off of one of the most popular keto websites. And you can see it's cheesy taco casserole. There are 3 pounds of beef and 6 cups of cheese, 2 cups of pepper strips in this casserole. And what you've got in 1/8 of the recipe is 787 calories, about 61 grams of fat, 70% of calories, about 30 grams of saturated fat. And just to put this into perspective, if you followed the American Heart Association or the American College of Cardiology, you followed their guidelines of not getting more than 6% of calories from saturated fat, you'd be looking at 13 grams in a 2,000 calorie diet. one serving of one casserole, and you've got 30 grams. So, and about 7 grams of carbohydrate, 49 grams of protein. That's enough for a day for most women, and only a half a gram of fiber, so very low in fiber. So let's move on to look at what a paleo diet is. A paleo diet is a pattern of eating that attempts to mimic the diet of our Paleolithic ancestors. And the basic premise here is the shift from a hunting and gathering diet that's rich in wild meat and wild plants to an agricultural diet that's rich in grains and legumes gave rise to our obesity and chronic disease epidemics. So that's what the belief is in the paleo crowd. So the paleo diet is a less extreme low carb diet. So instead of 5% carbohydrates, you've got about 20% carbohydrates, about 50% fat, and you can see a very large percentage of calories from protein at about 30% of calories from protein. And here's the Paleo Pyramid. And again, you see at the base of the pyramid, animal flesh foods like meat and poultry and fish and so forth. And then fruits and vegetables, and then nuts and berries. And again, no grains, no legumes. And in the paleo diet, also no dairy products at all. And the slogan here is, if a caveman couldn't eat it, neither should you. Here's a sample recipe, again, from a popular paleo website. And it's basically pork tenderloin and a reasonable number of vegetables cooked in coconut oil with added coconut milk. And in this recipe, half of the recipe is about 643 calories, 37 grams of fat, 16 grams of saturated fat, so less than the keto recipe, but still a lot. 54 grams of protein, 24 grams of carbohydrates, or about 15% of calories, and about 8 grams of fiber, so much higher in fiber than the keto recipe. So let's compare the paleo and keto diets. And in the blue, you see the similarities between the two diets, and in the pink, you see the differences. So first of all, in terms of meat, poultry, fish, and eggs, they're both very high in these foods. Nuts and seeds are included in both dietary patterns. Green vegetables are included. Legumes are excluded in both. Grains are excluded in both. Now, the similarities, dairy is excluded in, the differences. Dairy is excluded on the paleo, but included in the keto. So a keto diet is actually often very high in cheese and butter and these fatty, lower carbohydrate dairy foods. And non-starchy vegetables are included in paleo, but they're quite limited in keto. Starchy vegetables are limited in paleo, but completely excluded in the keto diet. Fruits are moderate in paleo and they're minimized in keto. And concentrated fats and oils are moderate in paleo and very high in a keto diet. So if you look again, here's the keto macronutrients versus the paleo macronutrients. So paleo, higher protein, lower fat, higher carbohydrate than the keto. So when we look specifically at carbohydrate restriction, keto diets around the 5 to maybe 10% at most carbohydrates. Other low carbohydrate diets are somewhere between 11 and less than 40% carbohydrates, with again, the paleo being somewhere in that range at about 20% of calories from carbohydrates. So how many grams of carbohydrates on a sort of typical 2,000 calorie diet? Well, for the keto, it's about 25 grams for most keto programs at about 5% of calories, or 5% of calories from carbs, and it would go up to about 50 if it's 10%. Paleo, it's around the 100 grams of carbohydrates per day. Now, if you think about the percentage of calories from carbohydrates in these two diets, we're looking at 5% for keto, maybe 10, about 20% for paleo. you look at the amount of calories from carbohydrates in plant foods, it tells you something. So at the upper end, you've got fruits at 92% of calories from carbs, then starchy vegetables at about 90, grains 75, legumes 70, down to non-starchy vegetables, which are very close to 60. And so you can see that there's not a whole lot of space for these kinds of foods that are that high in carbohydrates in these very low carbohydrate diets. The only plant food that is an exception are the nuts and seeds at about, sort of averaging about 12% of their calories from carbohydrates. Milk, fluid milk, is about 37% with a fair bit of lactose, or the milk sugar. Eggs and cheese are only about 3%. And of course, meat, poultry, fish, fats, oils are all 0% carbohydrate. There aren't any. So these are the foods that are really the mainstay of very low carbohydrate diets, because they don't contain any carbohydrates. So you might hear this term thrown around, net carbs, and a lot of people who are on low carbohydrate diets do this net carb thing, which is essentially a way of subtracting fiber from total carbohydrates, because fiber isn't digested. And so net carbs equal total carbs minus fiber. And it essentially allows people to eat a little more carbohydrates than you might think they would be allowed. And I'll give you an example here. So you've got, these are all the non-starchy vegetables. We've got total carbohydrates and net carbohydrates. And you can see, for example, eggplant. In a cup of eggplant, you've got about 17 grams of carbohydrate, but the net carbohydrate is just 12 grams, because there are 5 grams of fiber per cup of eggplant. And you can see asparagus, 6 total, 4 net carbs. These are just a few examples. Cucumbers, a cup, 3 grams of carbohydrate, 2 of net carbs. Now, I want you to notice near the bottom here is kale and spinach and these dark green leafy vegetables. Now, these are extremely low calorie foods, so they don't have a lot of carbohydrates, just a gram per cup. But if you look at the net carbs, you've got in kale only 0.2 grams of carbohydrate. So technically, you would be able to consume a fair bit of those leafy greens in a low carbohydrate diet. Now, if you look at the carbohydrate content of other foods, here we've got a cup of quinoa, a medium potato, a cup of chickpeas. You're looking at about 40 grams of carbohydrate in a serving, and 30 to 34 sort of net carbohydrates. So certainly those foods wouldn't fit in very well if your total, carbohydrate allowance is 25 or 30 grams a day. And then if we look at blueberries, for example, keto often says, oh, well, we allow berries. But if you think you're allowed 25 grams of carbohydrates for the day, a cup of blueberries has 21, and even the net carbohydrates are 17. It allows you almost no other plant foods for the day. It takes up your total allowance. Whereas something like sour cream or cheese, you're looking at an ounce of cheese, you've got a gram of carbohydrate, and that's it, both total and net, of course, because there is no fiber. And so what is more healthful, a keto diet or a paleo diet? Well, keto diets are the most extreme of the low carb diets. Fatty foods predominate in these diets, and plant foods are heavily restricted, whereas a paleo diet is less extreme. It allows more liberal intake of plant foods. So paleo, of course, is more healthful than keto. It has higher levels of protective nutrients like fiber and prebiotics and phytochemicals and antioxidants and plant sterols and all of those things. So let's move on to part 2, where we're digging deeper into both the keto and the paleo diet. So let's start with keto. And we're going to address, there are many claims about the wonders of keto diets in the keto world. We're going to look at 4 of those claims. And so they are: keto diets reduce epileptic seizures, they're the best diets for weight loss, they reverse diabetes, and they kill cancer. So we'll start with the looking at the evidence for these claims. So is there really any truth to these claims? Well, there is actually convincing evidence for epilepsy. And the research essentially has shown that about 36 to 85% of patients with epilepsy experience more than a 50% seizure reduction with ketogenic diets. And about 10 to 15% of these patients will actually become seizure-free. And these ketogenic diets are most effective for those who do not respond to medications very well, and those with epileptic syndromes like a GLUT1 deficiency. And of course, GLUT1 is what is necessary to get the glucose into the brain. And so if you can't get the glucose into the brain, switching to an alternative fuel like ketones can help to reduce seizures and improve cognitive function in these children. So as a therapeutic diet, it definitely works in this regard. However, it doesn't come without risks. And what we see is multiple documented side effects. We see a much higher risk of cardiovascular disease in these children on ketogenic diets. We see arrhythmias, cardiomyopathies, dyslipidemia, or high cholesterol and high, well, mainly high cholesterol. Malnutrition and stunted growth is very common. Bone disorders like decreased bone mass and fractures, constipation, dehydration, GI disturbances, metabolic acidosis, kidney stones, liver abnormalities, and blood disorders like anemia and neutropenia. So this is not minor side effects, as you can see. Moving on to weight loss, we have moderate evidence for effective weight loss with ketogenic diets. The research often looks mainly at short-term impacts, so studies of about 3 weeks to 4 months. And in these studies, there are reports of significant weight loss, favorable changes in body composition, and markers of inflammation in the short term, and effective appetite suppression as well. We have research that looks at low carb and ketogenic diets from sort of the 6 month to 1 year time frame. And there was actually a meta-analysis from 2020 that looked at 38 randomized controlled trials with almost 6,500 participants. Over half the studies were ketogenic diets with 10% or fewer calories from carbohydrates. The balance were just low carbohydrate diets with less than 40% of calories from carbohydrates. And keto and low carb diets led to about a 3-pound greater weight loss than what they called low fat diets. And they were they weren't truly low fat diets. They were diets that contained less than 30% of calories from fat. And these diets did lead to favorable changes in triglycerides and HDL cholesterol, but very unfavorable changes in LDL and total cholesterol, which could increase risk of cardiovascular disease. And research 1 year or longer, we do have a meta-analysis of 13 randomized controlled trials. And in this particular meta-analysis, the people on the ketogenic diet lost slightly more weight, about 2 pounds over a year, compared to what they called a low fat or less than 30% fat diet. Again, lower triglycerides, higher HDL, but higher LDL, which again can increase risk of cardiovascular disease. They didn't note any significant differences in blood pressure, fasting glucose, insulin, A1C, or C-reactive protein. And this is important, by 2 years, there were no differences between the ketogenic and the low-fat groups. Now, we also have a couple of metabolic ward trials, which I think are quite interesting. The first from 2016, and this is Kevin Hall's group, and compared to a baseline diet of 50% of calories from carbohydrates, comparing that to an isocaloric keto diet, or isocaloric just means the same number of calories, and about 5% of calories from carbohydrate. And this looked at what would happen in 17 overweight men. And it was actually an interesting design called a crossover design. So what the participants did was they ate the baseline diet for 4 weeks, and then they ate the ketogenic diet for 4 weeks, and they're in a metabolic ward, so there's no cheating. So these are really well-designed studies. And what was very interesting is the loss of fat-free mass or muscle tissue was actually greater on the keto diet than on the baseline diet. And it took 4 weeks on the keto diet to lose a half a kilogram or about a pound of fat, and only 2 weeks on the baseline diet. So weight loss was actually better on the baseline diet, and muscle preservation was better on the baseline diet than the ketogenic diet. And then they went on to do another trial, which was even more interesting in 2020. And this trial actually compared a low-fat plant-based diet, 75% carbohydrate and 10% fat, with a keto diet that was the exact opposite, 10% carbohydrate and 75% fat. And it was just a 2-week crossover design, but unrestricted food intake. So 2 weeks on low fat, 2 weeks on keto. And the ketogenic diet did lower blood glucose, it lowered insulin, it lowered triglycerides, but it impaired glucose tolerance, and it increased the loss of muscle tissue, again, as did the first trial. And in the plant-based group, it lowered blood pressure, cholesterol, and this I found fascinating, it lowered energy intakes, because on a ketogenic diet, you get appetite suppression. But the plant-based diet, people ate almost 700 fewer calories than they did on the ketogenic diet, which is really fascinating. What it was is that people were fuller on fewer calories because of the fiber in a whole food plant-based diet. And the other interesting thing was that on the plant-based diet, people lost 51 grams a day of fat, whereas on the ketogenic diet, they only lost 16 grams a day. That's, 51 grams is almost 2 ounces, and 16 grams is about half an ounce. So quite a difference there. The verdict, well, ketogenic diets do induce weight loss, but they may be less effective than very low-fat plant-based diets in doing so. And what we need to remember is there are lots of ways to lose weight. Anything that promotes an energy deficit will promote weight loss. It doesn't mean it's good for you. I put up this advertising here. This was an advertisement in the 1920s for cigarettes, and basically saying this is your best way of losing weight. It doesn't mean it's good for you. And if you're aware of the US News Best Diet Rankings, they do a diet ranking every year. And in 2020, out of 35 diets, keto diets, in terms of best overall category, keto diets ranked 34 out of 35. And in the best diets for healthy eating, keto diets ranked dead last. Why? Well, because they're very, very high in total unsaturated fat, they're very high in fatty animal products, they have a high potential for nutritional deficiencies, and they have multiple adverse side effects. So they're not recommended. We have limited mixed evidence for type 2 diabetes and cancer. And for type 2 diabetes, we do see short-term benefits with ketogenic diets. We see weight loss, we see improved blood glucose control, we see reduced A1C, and we see lower triglycerides. And often people are able to reduce medications because they're not consuming carbohydrates. But there's a huge downside. Keto diets help to reduce the symptoms of diabetes, but they actually increase insulin resistance. And insulin resistance is at the root of type 2 diabetes. So if a person eating a very low carbohydrate diet is challenged with a load of carbohydrate, they tend to have significant spikes in blood glucose because they remain so insulin resistant. So why do these diets fail to reverse insulin resistance? Because they fuel the drivers of insulin resistance. They fuel lipotoxicity because you're eating so much fat. They can fuel inflammation, oxidative stress, and of course they fuel dysbiosis, which is unhealthy gut microflora, because you're not feeding your healthy gut microbes. Healthy gut microbes need prebiotics, which is essentially fiber, and you don't get a lot of fiber in a keto diet. Long-term, we don't have any long-term studies. However, we do have a systematic review of low-carb diets, not necessarily keto diets, And there were no differences in weight or A1C with longer term treatment when it was compared to low fat diets, low glycemic index diets, or usual care diets. Now, I found this study very, very interesting, and this is from the Health Professionals Follow-Up Study. They looked at over 40,000 individuals. Over 2,600 individuals developed type 2 diabetes, and what they found was low-carb diets. They weren't necessarily keto, but low-carb diets, high in animal protein and animal fat, were associated with a 37% increased risk of type 2 diabetes. Low-carb diets, again, not keto, that were high in plant protein and fat were not associated with an increased risk overall, but were associated with a 22% decreased risk in men under the age of 65 years. Cancer, well, with cancer, the keto theory is sugar feeds cancer and cancer cells can't use fat, so keto diets cause cancer cell death. And the evidence comes from a number of small studies with 6 to 32 cases of, or participants per study. And the benefits reported are prolonged or partial remission of cancer, some improvement in quality of life, and improved effectiveness of a chemo drug for glioblastoma or brain cancer. And we have a couple of reviews. There was a comprehensive review from 2019 that found keto diets may slow some cancers if they're combined with chemo in the early stages of the disease, but not all tumors respond positively to keto diets. Actually, some respond quite negatively and seem to be fed by ketones. And studies have failed to show that keto diets increase survival in advanced cancer patients. And then there was a systematic review in 2020. And again, they found beneficial effects on body weight for both over and underweight participants. They found 4 out of 13 studies reported beneficial effects on overall survival and or progression-free survival. And their conclusion was basically, we need more studies to determine, the strength of the evidence. So we're not quite there yet. But again, if we look at prevention and we look at people, following people for years to see who will develop cancer, people in the lowest quartile of carbohydrate intake had a 36% higher risk of cancer mortality than people in the highest quartile of carbohydrate intake. And this is a 2019 study. They also had 50% increased risk of cardiovascular mortality and a 32% increased risk of total mortality. And the conclusion of the authors in this study is these data provide further evidence that animal-based low carbohydrate diets, which are more prevalent in North American and European populations, should be discouraged. And then I wanted to share this study because, again, it was really interesting from Japan. Over 70,000 individuals followed for, approximately 17 to 21 years by replacing 3% of calories from meat with plant protein. And here we're talking about 60 calories worth of meat with plant protein. You can reduce risk of cancer mortality 42% if what you replace is red meat with plant protein. And you can reduce risk of cancer mortality 50% if you replace processed meat with plant protein. Very powerful evidence. So what do we know about keto diets? Well, we know there are some potential benefits in terms of epileptic seizure risk reduction, reduced energy intakes, appetite suppression, weight loss, lower blood sugar, decreased triglycerides, and increased HDL. But we also know there are a number of risks. And short term, we see a lot of people developing symptoms of what we call the keto flu: weakness, fatigue, dizziness, nausea, vomiting, bad breath, muscle cramps, irritability, poor concentration, stomach pain, difficulty sleeping, and constipation, pretty consistently with people going keto. There are a number of other short-term risks as well: increased LDL, impaired artery function, impaired glucose tolerance, worsening kidney function, reduced athletic performance, and there are a number of long-term risks. We see increased all-cause mortality. We see increased exposure to what we call POPs, or persistent organic pollutants, which tend to move up the food chain. We see increased risk of birth defects like neural tube defects. We see kidney stones, bone loss, colon cancer, reduced risk or increased risk of cardiovascular disease, nutritional deficiencies, a non-alcoholic fatty liver disease, hepatic steatosis. So all of these things. Some people say, well, what about going vegan keto? It's not easy to do, but it is possible. We don't have any trials that have compared vegan versus animal-based keto, but we have a lot of trials showing that plant-derived fat and protein are protective to human health, while animal-derived fat and protein increase disease risk. Vegan keto diets are lower in saturated fat and higher in phytochemicals, antioxidants, fiber, plant sterols, and all of those good things than a regular keto diet. However, lower fat vegan diets beat keto vegan diets on all of these fronts. There is no contest. A lower fat vegan diet is far preferable. It will have more fiber. It will have more antioxidants. It will have more plant sterols and phytochemicals and all of those good things. So now let's move on to dig a little deeper with the paleo diet. So the paleo claims are for weight loss, reduced hunger, reduced sugar cravings, clear skin, increased energy, muscles, reduced flab, bigger muscles, lower flab, reversing diabetes, reducing inflammation, reducing cancer risk, reducing risk of heart disease. So you know, the question when I can remember when paleo diets became really popular, probably just over 10 years ago or so. And I can remember thinking to myself, you know, it makes sense that animals would consume what animals have always naturally consumed. And it's probably the same for people. But I thought to myself, even if it is a good idea to eat like our short-lived ancestors, they only lived about 20 to 40 years, we have to ask ourselves this question: what did our ancestors actually eat? Because I'm not sure the people eating paleo today are eating what our ancestors actually ate. So what did they eat? Well, pre-agricultural people ate wild plants, wild animals, fish, and insects. The balance of these foods varied according to the time frame, the location, their gathering and hunting skills, the season, tools, culture, all of those things. And so there wasn't one Paleolithic diet for sure. Of course, they didn't eat anything from a box or a bag. There weren't packaged foods. There were no deep fried or fast foods, no refined fats, oils, or sugar, or salt. There were no, you know, they didn't consume the milk of any other mammal or products made from that milk. They certainly didn't consume processed meats like bacon and ham. They didn't drink alcohol. And so the one thing that I would want to ask is, do these new paleo diets again equal true Paleolithic diets? So what I did was I went and did a little digging in nutritional anthropology reports, and I found two papers that basically estimated Paleolithic intakes quite carefully. And these two papers, one was from 1997, and that was Boyd Eaton and Melvin Connor. And the other was from 2010, and again, Melvin Connor and Boyd Eaton. And it was 25 years later. And in this paper, they state quite clearly that early ancestral diets were overwhelmingly plant-based, with some insects, very small amounts of animal flesh. If something was dead, they might eat it. But this was actually the first 80% of the Paleolithic period, where early ancestors were essentially vegetarian. The reliance on meat did increase in the latter 20% of the Paleolithic period as hunting skills of our ancestors improved. However, much proof points to continued significant, if not predominant, dependence on plant foods. And so here you have the dietary reference intakes of 4 macronutrients. Here you have the 1997 estimates, and then the revised 2010 estimates. And so basically the energy intakes were estimated to be about 3,000 calories during Paleolithic times. Protein intakes were estimated to be very close to 30% of calories, and the revised was 25 to 30% of calories. Carbohydrates were estimated in the 1997 paper to be 45 to 50%. And of course, the DRIs are 45 to 65%. And then in the revised paper, it was 35 to 65% of calories from carbohydrates. And they just ended up with a wider range to allow for the higher hunter-gatherers and the people that lived closer to the equator eating more plant-based diets. And fat was estimated to be originally 20%, and then they expanded the range from 20 to 35. Saturated fat was estimated to be 6% originally, and then 7.5 to 12% in the later paper. I actually questioned Melvin Connor on this, and he said the reason it didn't start at 6, as it should have, was because they were leaning, Boyd Eaton and others were leaning more towards these hunter-gatherer diets. And so it probably should be 6 to 12 rather than 7.5 to 12. And then the ratio of omega-6 to omega-3, about 2 to 1. And then the fiber intakes, originally they estimated to be about 104 grams a day, and later about 70 to 50, 150 or 150 plus grams a day. And so if you look at this all, there's something that just kind of jumps off the page at you. And that is, of course, the fiber intakes. They were unbelievable. Our DRI for women is 25 grams, for men 38 grams. Here in the original paper, 100 grams. Later, they estimated up to 150 grams of fiber a day. And of course, we all know where fiber comes from. Fiber comes from plants. So obviously, these were not very low plant diets. The average vegan probably gets 40 to 60 grams of fiber a day. If they're eating a super healthy diet, it might get upwards of 70 or 80 grams a day if they eat a fair bit of food. But we don't come close to the 100 to 150 grams, that's for sure. And if we look at the micronutrient intakes, absolutely interesting as well. So vitamin C, around 500 or 600 milligrams a day. Most vegans don't get that. Where does vitamin C come from? Fruits and vegetables. Calcium, 1,000 to 2,000 milligrams a day, and they weren't drinking any cow's milk. Where did it come from? Mostly plants. Potassium, 7,000 to 10,000 were their sort of estimates. Most vegans are lucky if they get 4. So again, potassium is found mainly in plants. So it's really quite interesting. And when I saw all of this, I said to myself, I wonder what comes closer to a true Paleolithic diet. This newfangled paleo diet or 100% plant-based vegan diet. And so I decided to do the math. I went to a paleo website and looked at their menu and analyzed 3 days of recommended, sort of their recommended diet. And you can see a lot of meat and eggs, but also some greens and berries and almond butter, nuts and seeds and so forth in this menu. And then I analyzed a recommended plant-based menu that was a varied plant-based menu, including lots of beans and grains and seeds and nuts and fruits and vegetables. And then I compared the true paleo of both of these with the true paleo diet to see which one actually comes closer. And so I made sure that they were all the same number of calories. So I analyzed and adjusted the calories to be 3,000 calories. So it could be a fair comparison with the 3,000 calorie true paleo diet. And so in terms of protein, the new paleo diet came closer to a true paleo diet at about 32% of calories from protein compared to the recommended 20 or the estimated 25 to 30% in true paleo. The plant-based diet was 15% of calories from protein. But carbohydrate, fat, and saturated fat were all closer on the plant-based diet than on the paleo diet, or sorry, on the new paleo diet. So carbohydrate was 15% in the new paleo, and 57 on the plant-based, so much closer to a true paleo. And fat was 53% on the new paleo, and the estimated is 20 to 35%. And saturated fat was almost 20% of calories in the new paleo. And as you recall, it's some 6 to 12% in the true paleo diet. The ratio of omega-6 to omega-3 was also closer on the plant-based. The fiber was closer on the plant-based. And if we look at the micronutrients, well, riboflavin, thiamine, vitamin C, and vitamin E were all closer on the plant-based diet than on the new paleo diet to a true paleo diet. Vitamin A and zinc were both closer on the new paleo diet to a true paleo diet than the plant-based, but everything else was closer on a plant-based diet than it was on the new paleo diet. And so in summary, the paleo diet came closer to a true Paleolithic diet for 3 nutrients: protein, zinc, and vitamin A. And the plant-based diet came closer to a true Paleolithic diet for 13 nutrients: carbohydrates, fat, saturated fat, essential fatty acid ratio, fiber, riboflavin, thiamine, vitamin C, E, iron, calcium, potassium, and sodium. So the bottom line is this new paleo diet that people are following does not equal a true Paleolithic diet. And you might ask why? Because in Paleolithic times, when people were eating hunting, gathering kind of diets, they were eating meat and plants. And that's kind of what the paleo people today are trying to do. But today's paleo diet devotees are emphasizing meat as opposed to plant foods they're emphasizing the meat that would be required to get 30% of calories from protein, instead of the plant foods that would be required to get 70 to 150 grams of fiber, or 7,000 plus milligrams of potassium, or 500 plus milligrams of vitamin C. And so they're really emphasizing plant or animal products instead of plant foods. And we have to recognize wild meat does not equal domestic meat. Meat from wild animals is lower in fat, 6 to 16% of energy from fat, versus 30 to 60% in farmed animals. Wild meat is lower in saturated fat, higher in omega-3s. It's free of antibiotics and added hormones. And wild plants do not equal domestic plants. Cultivated vegetables and fruits have been bred for appearance and palatability and transportability and digestibility and yield. Wild plants deliver 3 times the fiber of commercial plants. They're more concentrated in vitamins, minerals, and protein, and they're lower in sugar. So there are differences, but we still see reduced disease risk in short-term clinical trials for paleo diets. We see reduced body weight and increased satiety, improved blood lipids and lower blood sugar, and better insulin sensitivity and less inflammation and decreased blood pressure. So why the favorable results? Well, the paleo diets that are used in clinical trials try to mimic true paleo diets or Paleolithic diets more so than what the average Paleolithic diet eater are consuming. They eliminate fast foods and fried foods and processed meat and refined grains and refined sugar and concentrated fats and oils and high fat dairy products and alcohol. And they eliminate all of those things, whereas not all people following paleo diets may do so. But my concern is that we're talking about short-term gain for long-term pain, because while paleo diets may induce weight loss and favorable lab results in the short term, there are really significant concerns about adopting such diets long-term. Paleo diets are high meat diets. They're high in animal protein. They're high in agrochemicals that move up the food chain. They're high in persistent organic pollutants. They're high in carnitine that can be converted to TMAO, which is highly atherogenic. They're high in endotoxins, which cause inflammation. They're high in environmental contaminants in heme iron, which is a pro-inflammatory component, or a pro-oxidant, I should say. They're high in new 5GC, which is highly inflammatory, which is also found only in meat, mainly red meat. They're high in nitrosamines quite often if they're processed. They're high in products of oxidation. They're high in saturated fat and cholesterol. And so how much meat are we talking here? Well, typical recommendations, as you recall, are 30% of calories from protein. In a 2,000 calorie diet, that's 150 grams. In a 2,800 calories diet, that's 210 grams of protein. And assuming 80% of that protein comes from meat, we would be talking about 16 ounces of meat per day in a 2,000 calorie diet, and 22 ounces of meat per day in a 2,800 calorie diet. How much meat is really safe to eat? Well, Walter Willett, who's the most cited nutrition expert in the world with over 1,700 original research papers and reviews, says the following: if you step back and look at the data, the optimum amount of red meat you eat should be 0. And so let's move on to looking at plant-based versus low carb. Well, we have clear, consistent evidence that whole plant foods are protective to health, that heavily processed foods, fast foods, and fried foods with added fat, sugar, and salt are damaging to health. And meat, especially processed meat and red meat, increases our risk of disease. And for this reason, national and international dietary guidelines are very clear that we should be eating predominantly plant foods. This is the #1 recommendation in the World Health Organization's 12 Steps to Healthy Eating. Eat a nutritious diet based on a variety of foods originating mainly from plants rather than animals. If we look at the FAO plates, pyramids, and planet, they actually highlight international leaders who are doing a good job of recommending more plant-strong diets. Germany, choose mostly plant-based foods. Brazil, eat foods mainly of plant origin. Qatar, emphasize a plant-based diet, including vegetables, fruits, whole grains, legumes, nuts, and seeds. UK, eat more plant-based foods, including at least 5 portions of fruits and vegetables a day. And if you look at recommendations of cancer organizations, eat a healthy diet with an emphasis on plant foods from the American Cancer Society. Eat mostly foods of plant origin from the World Cancer Research Fund. Choose mostly plant foods such as vegetables, fruits, whole grains, and cut sugary drinks from the American Institute of Cancer Research. And the Eat Lancet Commission from 2019 basically tried to establish healthy diets from sustainable food systems to help safeguard our planet and improve the health of billions of people. And their universal healthy reference diet: increase intake of healthy foods like vegetables, fruits, whole grains, legumes, and nuts, and decrease consumption in unhealthy foods such as red meat, sugar, and refined grains. And if we look, I'm a Canadian myself, and our national food guide has made a major shift. And you can see half the plate is fruits and vegetables. And they say, have plenty of fruits and vegetables. They say, choose a quarter of the plate is whole grains. And they say, choose whole grains. And they also say to eat protein foods, a quarter of the plate is protein foods. But they add to choose protein foods that come from plant-based foods more often. Make water your drink of choice. We don't any longer have 4 food groups where 2 of the 4 food groups are animal-based, dairy and meat and alternates. So it's a food guide that is very much progressing in the direction of plant-based eating. And to me, the acid test is looking at the longest lived healthiest people on the planet. And these, of course, are the people of the blue zones. And this man in this image here is an Okinawan centenarian. So he's 100 years of age. And this is, I think, the goal, really still very productive at that age. And the blue zones have certain features that are common to every single blue zone. And they are a strong sense of family. No, they tend not to smoke. They tend to be socially engaged. They do constant moderate physical activity. And in terms of diet, they all consume plant-based diets and they all consume legumes. If you look at the average carbohydrate intakes among people in blue zones, 62% of calories from carbohydrates, not 5% as keto diets recommend, or 20% as paleo diets suggest. And then we've got the Saimane from Bolivia, South America. These folks live a traditional hunter-gatherer lifestyle, and they have the lowest reported rates of heart disease of any population on the planet. Their diet is 72% of calories from carbohydrates. So it's a very, very plant predominant diet. And if we look at longevity and low carb diets, there was a study from 2018 that found that low carb diets are reported that low carb diets are consistently associated with increased mortality. And I looked at some of the data in this report, the fine details. And they included a cohort called the ERIC cohort with over 15,000 participants, over 6,000 deaths in this cohort. And they looked at all-cause mortality and adjusted for age, race, and gender, and compared the people eating various levels of carbohydrate intakes. And the reference in this population was 50 to 50% of calories from carbohydrates. And those eating less than 30% of calories from carbohydrate had an increased risk of all-cause mortality of 58%. Those eating 30 to 40% carbohydrate, mortality was increased 32%. For those eating 40 to 50% carbohydrate, it was increased 12%. The people eating 55 to 65% of calories from carbohydrate, there was no difference in mortality. And those eating more than 65%, the mortality risk was increased by 15%. However, in this cohort, the people with increased risk from very high carbohydrate diets were poor people eating refined carbohydrates, like a lot of white rice. And so that, I think, explained the difference. And there was a segment of the population that had much lower risk, even than the 50 to 55% range. They had a much lower risk of mortality. Those I would expect would be the people eating whole food plant-based diets. And what was interesting in this study is that mortality was increased 18% when carbohydrate was exchanged for animal-derived fat or protein, but decreased 18% when the substitutions were plant-based. So the bottom line is it makes little sense to me to promote diets that limit the most protective dietary components, the fiber and phytochemicals and antioxidants, while maximizing so many of the pathogenic or harmful dietary components when there is a more healthful and effective dietary protocol. And that is, of course, a whole food plant-based diet. So, and what's really surprising is the paleo founders concur. Boyd Eaton and Melvin Connor are the founding fathers of the current paleo diet. Much of the essential foundation of the movement is based on their research. And they agree that 8 billion people can't eat a meat-based diet without sacrificing the planet. During the Paleolithic period, there were probably about 1 million people on this planet. Today, there are 8 billion. We can't be eating in the same way. Their advice: eat less meat, get most of your protein from plants. So we will conclude this presentation talking about the good, the bad, and the ugly where low-carb diets are concerned. The good is that low-carb diets eliminate refined carbohydrates, starches, white flour products, sugars like soda. They eliminate many of the highly processed foods. The bad is they're high in fat, saturated fat, and cholesterol. They're high in pro-oxidants and chemical contaminants. They're low in fiber, phytochemicals, and antioxidants. And they have a ton of potential nutrition shortfalls, especially with keto diets. They're low in potassium and magnesium and calcium and iodine and folate and vitamin A, vitamin C, and vitamin K. And the ugly is low-carb diets are high animal food diets. They are both ecologically unsustainable and ethically unjustifiable, in my opinion. Low-carb diets downplay the ecological crisis that makes eating lower on the food chain an ecological imperative. If our entire population ate a low-carb diet, our planet's dwindling resources would very quickly run dry. And David Katz did the math on this. If we all ate paleo, we would need an estimated 15 planet Earths to sustain our current population. It boggles the mind that we have people recommending, physicians recommending that people consume a paleo diet when it would be so devastating environmentally. You know, there was a study in the proceedings of the National Academy of Sciences from 2016 that estimated by 2050, greenhouse gas emissions would be reduced by 29% if everybody followed the global dietary guidelines to eat more fruits and vegetables and eat less meat, sugar, and calories, but by 70% if we all adopted a vegan diet. And their recommendation was a global shift to a plant-based diet. And of course, these meat-heavy diets are also ethically unjustifiable. If everyone ate animal-centered diets, both human and animal suffering would escalate. Animal-based diets breed human hunger because the greater our meat intake, the more resources we use to, and we feed fewer people. The water, the land, all of these resources, if everyone ate plant-based, our global calorie supply would increase by an estimated 50%, which could effectively wipe out hunger. And animal-centered diets hurt animals. It, to me, makes no sense to cause pain, suffering, and death in other living beings when it is usually unnecessary. I know there are some populations in the world that require, for example, the Inuit require fish and so forth for their survival, but for most of us, it's unnecessary. We slaughter 70 billion land animals every year for food. Most are raised in CAFOs or confined animal feeding operations. Probably 90% plus in North America. The numbers would escalate if everyone adopted low-carb animal-based diets. And I love the work of Dr. Albert Schweitzer. He won the Nobel Peace Prize in 1952. I believe he died in about 1965. And he said, back in those days, that the time is coming when people will be amazed that the human race existed so long before it recognized that thoughtless injury to life is incompatible with real ethics. Ethics in its unqualified form is extended responsibility to everything that has life. And I think Dr. Schweitzer would be absolutely appalled that we are not there yet. The ultimate question to me is this: how can humans best adapt to their current environment to sustain a growing population on a shrinking planet? By getting our nutrition from plants, we all win. And we have a choice. When we consider the consequences of our food choices, not just for ourselves, but beyond ourselves, a plant-based diet becomes an ecological and an ethical imperative. And with that, we will conclude. And this is just a sampling of my books. I've written a dozen books. So yeah, just an image there. And thank you so much for your attention. I can take questions.
Wow, Brenda, that was amazing.
Oh, thank you.
Yeah, I'm exhausted. How do you do it?
What a tour de force.
A tour de force, and the slides were all beautiful. And wow, you have such a good, what a message, and a sense of aesthetics too. Unbelievable.
Oh, thank you.
Yeah, Susan, you have a question for our esteemed speaker.
Yeah, we've had a lot of questions coming through. One, I'm going to combine one of my own with a question that somebody else had asked. You had mentioned about the keto diet being the evidence for keto diet being helpful for epilepsy. And I had an adult patient who had new onset epilepsy. And is there much evidence for the value of a keto diet for adults? That's the first part of the question. And then the second part is, what is the proposed mechanism for its effectiveness?
Yeah, and I actually haven't seen a lot of literature about keto diets for adults with epilepsy. So that's a really good question. And the, in terms of, although I think that, it might be worth a try in some severe cases that are non-responsive to medication. And of course, if a person is doing that, it's really hard to do a vegan keto that's only 2 to 4% of calories from carbohydrates. It's just really, really difficult. But for people with severe epilepsy, you need to try what you can try. I actually ran across one little guy that had epilepsy that was able to reverse his or get rid of his epilepsy by eliminating gluten. It turned out he had celiac disease, and his parents didn't realize it. And so there are many potential reasons for epilepsy, but for some children, there are syndromes where they can't get glucose brought into the brain very effectively. And so their brain is starving. It needs some form of fuel. And so by getting ketones into the bloodstream, they get fuel into their brains, and this can help for some of these children. And so, in this circumstance, a ketogenic diet obviously could make absolute sense. And that is really the only, I think, argument for ketogenic diets therapeutically, in my opinion. There may be some brain cancers that respond well. It's again a different form of fuel for the brain, but we still have a ways to go before we understand that. At this point in time, I would say, it's not there. There are not very many other reasons to do this.
Thank you.
Great, thank you. So just a reminder to the audience, please put your questions in the Q&A section. It's easier for us to find those. So here's a question from someone who is a CDCES or Certified Diabetes Educator. And so welcome. And the question is, if a person with diabetes is supposed to minimize carbs to regulate blood sugars, how does a plant-based diet fit? I am a diabetes educator and find it difficult to teach patients to embrace a plant-based diet.
Well, this is a great question, and thank you so much for joining us. I really appreciate it. We, both, certainly Dr. Friedman, Dr. Barnett, myself, we have worked with many, many patients on, who have type 2 diabetes, on reversing their disease. And what we've generally found is you don't need to be reducing carbohydrates as much as you think you need to be reducing carbohydrates, because if you look at the drivers of insulin resistance, we're looking at lipotoxicity, oxidative stress, inflammation, dysbiosis. All of those things are vastly improved on a plant-based diet. You get, lower levels of oxidative stress. You get reduced inflammation. Your gut microbiota are hugely improved. And the biggest thing is lipotoxicity. So when you are consuming excessive calories, your liver can only handle so many excessive calories. And at some point, you end up not able to shuttle all the excess calories into your adipose tissue. You just can't keep up with all the calories. So some of the excess calories get stored as fat in tissues that shouldn't be storing fat. So we call this lipotoxicity. Some get stored in the liver, some get stored in the pancreas, some get stored in the muscle tissue in the form of intramyocellular lipids. And when you have all of this fat stored in these tissues that shouldn't be storing fat, it hugely increases insulin resistance. And what we find is on a plant-based diet, you're reducing, and first of all, you're losing weight, you're reducing lipotoxicity and all of the other things I talked about. And we see tremendous results. I can remember in my work in the Marshall Islands, we found within a week, for most of our participants, we had to stop medication or at least decrease it significantly. Everyone who was on insulin had to go off their insulin. It was remarkable. And this was on a plant-based diet that was probably around 70% of calories from carbohydrates. And I know the diet that you're using, Dr. Barnett and Dr. Friedman, is probably even higher in carbohydrates, and you still see amazing results. So I think this is important to recognize. And so high fiber, we really focused in the Marshall Islands on beans and greens and non-starchy vegetables, fruits, and these foods were hugely important. And then the grains and the really concentrated carbohydrates, we had to be a little more careful of, because people were so carbohydrate sensitive, especially in the Marshallese population. And so we loaded them up with beans and vegetables and fruits and so forth. And then we portioned out the concentrated grains and starchy vegetables. And so this allowed them, they were very satisfied, and this allowed them to lose weight at a very reasonable rate and regain their insulin sensitivity. And I think that's really ideal when you're working with people with type 2 diabetes. And the other thing to recognize, and this is something that I often teach, is that all whole grains are not created equal. So you need to be careful with people with type 2 diabetes. If they think, sort of whole grains are a free-for-all, they end up eating a lot of breads and muffins and, of these products made from flour. And flour is rapidly absorbed into the bloodstream. And so what I teach is something I call the whole grain hierarchy. And at the top of the hierarchy are intact whole grains like oat groats and kamut berries and wild rice and quinoa and so forth. And then as you start to process the grains, you cut them. So you got steel cut oats, and then you roll them. So you've got rolled oats, and then you shred them for shredded wheat, and then you grind them for different flours. And then you make, flaked cereals, and you puff them. And as you go down that hierarchy, you are processing the grains more and more and increasing the rate at which they'll be absorbed into the bloodstream. You're increasing the surface area of those grains. And so you want to go higher on that hierarchy and stick more to intact grains. And I just saw a question about the rolled oats and eating rolled oats. And I think that's absolutely fine if you're eating rolled or cut. But my preference would be to eat oat groats. And I love oat groats, and they're chewier and they have a much lower glycemic index. So for example, an oat groat might have a glycemic index in the 40s, 45, 48, something like that. Whereas rolled oats, it'll be 55. And so that's, it's still a low glycemic index food, but it's at the upper end of the low GI range. And so the less processing, the better. And that's also important when you're working with people with type 2 diabetes, is you want them to be eating, as unprocessed as possible, these whole high fiber foods. I hope that's helpful.
Yeah, thank you. I couldn't, I have to jump in here because to talk to the diabetes educators and anybody else with type 2 diabetes. Um, we have had personal experience. We basically teach the whole food plant-based diet with for the first 2 weeks is very low fat, just like an Esselstyn diet. And we did have a patient come to us with a hemoglobin A1C of 12.6, completely untreated. So as you know, his average blood sugar was 300 or 400 for quite a while. And within 3 months, his hemoglobin A1C was 6.0, and it's now a year and a half later, it's 5.4, all without any medication. So, and you know, you'll typically have people with diabetes, they're scared of us because they say, I'm not supposed to have any carbohydrates. And we just say, hang in there, you're going to be okay. And so far, it's always worked. So,
Yeah. And just
Dr.
to
Kessler.
reiterate, I mean, that's something that we see happening very quickly on our, with the 15-day Jumpstart program. Our average drop for patients who start in the diabetic range, our average drop in fasting glucose is almost 40 points, and that's just in 2 weeks, So, and the longer they go along this pathway, the better their control gets. But it's something that happens pretty rapidly.
Yeah, and in the Marshall Islands, our average first 2-week drops were in the range of 75.
Wow.
Yeah, but mind you, they probably started higher too. But yeah, this is very typical.
Just a reminder, yes, this is being recorded. And we'll be sending out a link to everybody who's in attendance you can link to the recording when it's ready. Susan, do you have a?
Yeah, there's an interesting question. Can you talk about kind of what the body goes through as it moves from, if someone's on a keto diet, where they're getting most of their energy from fat, and they move to a plant-based diet where they're getting mostly carbohydrates. What happens and how does the body kind of handle that?
Well, when it would depend on a lot of things. It would depend on how long you've been keto. I would say the first thing that would happen is, of course, you're going to shift from using ketones to using glucose as your primary fuel again. But the biggest changes to me are going to be changes in your intake of fiber, for one. And that will change your gut microbiome pretty quickly. And it could be a little uncomfortable at first, because you will not be able to handle as much fiber as you're eating in the early days. So you want to make a sort of a gradual shift. So it's your body can adjust slowly to eating more fiber, and your gut microflora has time to adjust. When you have a healthy gut microflora, you end up producing a lot more of sort of the anti-inflammatory compounds that are protective, not just to your gut, but to your brain, to every single body system you can think of. So I would say I wouldn't be terribly worried about making that shift, but I think I would go relatively slowly with the fiber. So start out by increasing, like I would start out probably by increasing, including some non-starchy or some starchy vegetables, more non-starchy vegetables, more fruits, more starchy vegetables, before going wild with the legumes and grains. So just gradually introduce those to allow your body a little more time to adjust. Anything to add there, Dr. Barnett or Dr. Friedman, would you say?
In the terms of I actually was typing an answer to another question just now. I'm sorry.
Oh, okay. In terms of the transition. From keto.
So, right. So I think one of the things that we know is that the keto, and you've talked about this, is that the keto diet does not help with insulin resistance.
No.
So people become insulin resistant because they're, as Brenda was talking about, there's this lipotoxicity, there's intramyocellular fat, and they appear to be improving because they're not being challenged. So with carbohydrate load. So if you switch over to a whole food plant-based diet, the intramyocellular fat and other extra fat comes out of the cells, and now you become insulin responsive. And so as long as your pancreas is still able to make insulin, which for most people with type 2 diabetes, they can, then basically their diabetes can improve significantly or even resolve. So I think that's one of the big things that takes place. As far as like being careful how to go about it, I don't really have an answer to that. I don't think we've looked at that. I don't know of anybody who's gotten sick by making the transition too quickly. So, and I wouldn't think that would be an issue.
Yeah, I mean, I think your point about fiber is well taken, because so many people are so fiber deficient, you know, and they can certainly experience some distress if you know,
That's right.
they
Yeah.
increase it too quickly.
Yeah, we certainly hear about that.
Yeah.
But it doesn't last that long.
No.
Maybe a few days, a week. Any other questions there, Dr. Friedman?
Interesting question from Jane Dorsey, our wonderful nurse practitioner. Do the Inuit people have higher rates of cardiac disease?
Well, you know, it's interesting
I don't
because
know
there's
the
been
answer.
some controversy about that, but I would say from everything I've read, yes.
All right. So here's an interesting question. Now, what are your opinions of things like Beyond Meat and Impossible Foods? And they go on to kind of answer the question themselves, but I'll just want to hear your answer. What do you think about
well, my answer is I celebrate anything that would reduce, you know, the slaughterhouse experience for animals. So I definitely celebrate Beyond or Impossible or whatever else, if it means that an omnivore will choose you know, a plant-based burger over an animal-based burger. And there are people think that from a nutritional perspective, they're about the same. They're not. Don't get confused there. They're not. A plant-based burger is nutritionally superior, in my view, for several reasons. Number one, there's fiber there. Number two, there's less, usually, not always, but less saturated fat. There's no cholesterol. There's no new 5-GC. There are fewer persistent organic pollutants. There are fewer endotoxins. You know, a lot of those things we talked about will be lower in the plant-based burger. So I think I absolutely think that these foods have a place. And for people that like to have some veggie meats or veggie burgers once in a while, there are a lot of choices. So the ones that taste a lot like meat tend to be a little higher in fat. The ones that are made from black beans and quinoa can be quite a lot lower in fat. You can make your own at home using all sorts of different things. So I think that, you know, I definitely celebrate their existence, even though they may not be the whole food, plant-based diet type foods. They still have a place and they serve a wonderful purpose, in my opinion.
Thank you for that. What else, Dr. Friedman?
Question about someone who follows 90% whole food plant-based diet with about 10% processed foods like vegan vegan cheese, and so forth. And their triglycerides and cholesterol are high. They're very active, but would being 100% whole food plant-based bring those down?
Yes.
Yeah.
Simple answer. Because and it depends on what the quality of some of the things you're using, but some of the vegan cheeses are very high in saturated fat. They're coconut oil based. So, you know, I make a vegan cheese out of cashews. You know, there are different levels, but even that, you want to keep your intake relatively small. But a lot of these processed foods, they use inexpensive oils, they use sugars, and it's, you know, it's just not the highest quality of foods that are used to produce these products. So as much as you can, try replacing them with whole foods and see what happens. Now, we do see people who have high cholesterol levels who it's not necessarily, diet related. It may be that they have thyroid, they're hypothyroid, for example, and that can cause elevated cholesterol levels. But generally, fine tuning the diet and getting to a truly whole food plant-based diet as close to 100% as you can. Not very many people are truly 100%. Even myself, I like to use a little bit of tamari or something like that once in a while. So that is a processed food. So most of us use a little bit, but basically you're wanting to get to that sort of 95 to 98% if you can.
Mm-hmm. Actually, that question really is perfect for that questioner is perfect for our 15-day jumpstart, because we tell people, look, you're a grown-up, you can do anything for 2 weeks, and we get your blood values measured before and after, and within 2 weeks you get amazing changes in most people. So our record for cholesterol drop in 15 days is 150 points. Someone came in with a total cholesterol of 299, chronic kidney disease, and on day 15 it was 149.
Wow.
So 150, that's that's an outlier, but typically we see 40, 50, 60, 80 point drops in 2 weeks. And so I think the person who asked that question might want to give that a try either on their own, or we'd be happy to have you join one of our jumpstarts. You can go to our website and sign up. We do them every month and all over the planet now. So
that's awesome.
Yeah. Any other, what else, Dr. Friedman? Here's really one. Well, would there be any reason for triglyceride levels to rise after going on a whole food plant-based diet? Brenda, what do you think about that?
Well, when not on a whole food plant-based diet, normally what we see on a whole food plant-based diet, as we did in the Marshall Islands in my research there, is a reduction in triglycerides. However, we do see increases in triglycerides in people that go from eating a typical meat-based diet to eating a refined carbohydrate plant diet. So they kind of go from meat and cheese to pasta and bagels. And if you're eating a lot of refined carbohydrates, especially added sugars, you can see your triglycerides rise. So you want to be very careful to make sure that it really is a whole food plant-based diet and you're not including refined carbohydrates. But typically, and you guys can add something to this, we typically see reductions in triglycerides.
That's interesting. We often have people whose triglycerides go up.
Really?
The cholesterol comes down, their LDL comes down, but the triglycerides go up, and we maybe we're just maybe it's because they're having too many refined carbs. I mean, I would say on average it goes down, but that's one of the numbers that we tell people don't worry about because it's going to get better eventually.
Yeah.
But it often does spike. We see that early on.
But
not in the long run.
We actually had a very consistent plunge in triglycerides in the Marshall Island research. The triglycerides went down very, very significantly, but we were really quite rigid about not using flour products. We were very intact whole grain. So barley was our sort of a mainstay, barley and a few other intact grains like kamut, things like that.
What about oatmeal?
Oatmeal, we generally, we did include a muesli, which was a soaked oatmeal with nuts and seeds and such. So and that may be the other thing is that our diet was a little higher in nuts and seeds than you're not using nuts and seeds. So we included some nuts and seeds, and that may be part of the difference as well, because it's lower in total carbohydrate.
Sure.
So.
Interesting.
Yeah.
Dr. Friedman, did you find another question there?
I think this is an important mechanism question. So can you just talk a little bit more about insulin resistance? What do you mean by that? And
So insulin resistance is when you're producing insulin. Your body's making insulin, but your body isn't able to use insulin as it should. So your insulin, and you might be able to explain this better than me, but insulin, there's a receptor site for insulin, and the insulin then sort of unlocks the doors to allow sugar into your cells. And when you're insulin resistant, you've got all this insulin floating around, or even it might even attach to the receptor site, but it can't do its job. It's like there's gum in there or something, and it's just not able to do its job. And so that's insulin resistance. You make insulin, but the insulin isn't working properly. And so the beauty of that is that your pancreas is still functioning. And if you can overcome your insulin resistance, your type 2 diabetes can completely reverse. It can go into remission, or it can completely reverse itself. And so that's the good news for many people with type 2 diabetes. Now, some people with type 2 diabetes who've had it for 20 or 30 years, your pancreas has been on overdrive trying to put out extra insulin for so long that eventually your beta cells can start to shut down. And especially if you get lipids in your pancreas, you get fat in your pancreas, and it kills beta cells. And so that can be a huge issue. But there is some, suggestion that some of the beta cells can actually be turned back on, depending on how long you've had the diabetes and so on. So people that will be most responsive to reversal in the early days are people that have had type 2 diabetes for a shorter period of time, of course. And of course, weight loss is really important, and getting rid of the lipids that are stored where they're not supposed to be stored: the pancreas, the liver, the muscle tissue.
Great. Excellent. Thank you. Somebody's asking, when are you going to have a Spanish language version of your Nourish book?
Oh, if you want to translate or know of anybody, we would love to have a Spanish translation, because it's just such an important language, and it's, so many countries in the world. So we're definitely open to that possibility. We have talked to our publisher about it, but of course we need a publisher in Spain or someone, willing to take the book on. So.
Right. So if the person asking the question is a volunteer to translate, get in touch with us, and we'll get you in touch with Brenda Davis.
Oh, that would be great.
Yeah. How about this question? Are avocados and olives good to eat? Should there be any limits?
I think they're wonderful foods myself. Avocados have been associated with all sorts of health benefits. However, they have a lot of calories. And so if you're looking at 300 or 400 calories, depending on the size of the avocado, and you're trying to lose weight, and in order to lose weight, you can only eat 1,200 calories a day. You can't be eating avocados you might be able to have a couple of slices on your salad, but you certainly can't be eating them whole. They're just a very concentrated source of calories. And that's the same with nuts and seeds. And so if your diet permits some nuts and seeds, you're sprinkling them on your salad. You're not eating them by the bowlful, because they're 800 calories per cup, or 600 to 800 or thereabouts. So they definitely, those foods, even though I believe them to be very nutritious foods, they're wonderful foods for children, for athletes needing more calorically dense diets. But certainly for people that are trying to limit caloric intake, they need to eat those foods with that in mind, if they're eating those foods.
What about for older adults who are underweight? How would you?
Oh, absolutely. I think they're wonderful foods for that population.
Excellent. Well, we are really running out of time. I mean, the Q&A is lighting up here, and there's no way we're going to ever get through all these and be in bed before midnight. So, Dr. Friedman, I'll let you find the last question here, and then we're going to have to, yeah. While you're looking, I just want to remind everybody that our next speaker will be Ginny Messina. We'll be talking about bone health, and that will be in May. I don't have the date in front of me, but if you go to our website, which I'll do in a minute and let everybody know, but she's also a wonderful speaker, just as Brenda Davis is. So we'd love to see you there.
And I'll add that Ginny Messina, if I can, Ginny Messina is one of the the pioneers of vegetarian and vegan nutrition, and I think she was the first president of the sort of vegetarian arm of the Academy of Nutrition and Dietetics, was co-author for many of their position papers, and just a wealth of knowledge, and a wonderful, wonderful plant-based dietitian. So.
Yeah, thank you for that. Yeah, actually, I found the date. It's Sunday, May 16th. So at 7 o'clock, just like this event. So Sunday, May 16th. We'd love to see you there. Dr. Friedman, what's our last question?
Oh, well,
no pressure.
We have someone's asking for a quick summary of, they say the quick start. I think they mean the jump start program. Why? Do you want to say?
Sure. So our 15-day jumpstart is we run it every month, and the reason we chose 15 days for very scientific reasons. It begins and ends on the same day of the week. So back before COVID, we were running it in our office, and patients would come in 3 Saturdays in a row, plus the first Sunday for a cooking demonstration. But basically, there were 3 Saturdays that they would spend 3 or 4 hours in our office. We would do finger sticks and give them their lab results right then and there. And it was kind of a proof of concept. We demonstrated that people could do it and they would enjoy it. And we were bringing between 24 and 30 people at a time into the office. And that's the paper that Dr. Friedman talked about that she just got published in the American Journal of Lifestyle Medicine. It's based on those first roughly 400 patients and how well they did. And then COVID-19 came along. We thought we'd have to quit because we can't get together. And then actually it got even better because now we have, in addition to those 4 weekend days, we have 3 Wednesdays, including a day -3 for people to check their Zoom connections and get their recipes and shopping lists in order. And it's turned out to be just a lot of fun. It's very supportive. The current group has about 35 or 40 people in it. And now we're doing around 35 to 40 generally. And it's very scalable. So we're getting ready to ramp this up and take it out to the rest of the people on the planet. Because as Brenda Davis was saying, this is basically a planetary emergency. We don't have a lot of time to get our act in order as far as getting greenhouse gases under control and maintaining a support system to feed 8 billion people. And not only, fortunately, it happens to be the healthiest diet. So we're not asking people to sacrifice their health for this. We're actually asking people to become healthier, which is what you would expect from physicians. So if you really want to get a detailed look at that, take a look at our website, and you can, there's a lot more information about it. And it's just a lot of fun. We have people from 35 states, 3 Canadian provinces, the UK. And so I just love it when people from different parts of the world can talk to each other on the little rectangles. It's just really a blast. So yeah. And Brenda is on our scientific advisory board for Rochester Lifestyle Medicine Institute. And I just, so to let everybody know, we don't allow any high-fat plant foods for the first 2 weeks, but we do ask people to, after the 2 weeks are over, to experiment with that. I think we may be moving more towards intact grains. We do encourage intact grains, but we don't necessarily discourage flour products as much as maybe we should be. We ask people to limit them, but not restrict them. So maybe we'll see even better results. But we get amazing results, as I said. We're seeing just wonderful results. Anyway, so that's an answer to that question, Dr. Friedman. We'll have one more question for Brenda Davis.
Yeah, so one more question. What supplements do you recommend for those who are on a whole food plant-based diet?
Again, it depends on your age, your state of health, and all of that. But for the average person, the supplements that are required are vitamin B12 for sure. 1,000 micrograms twice a week is what's generally recommended for adults. Many people require vitamin D. It's very hard to get enough even from fortified foods. So I would suggest a vitamin D supplement, especially for people living in cooler climates during those winter months where you're not getting enough sunshine. But there are even studies showing, in Hawaii, people have vitamin D deficiency. So I would suggest a vitamin D supplement. Then the other one that may be necessary for some people is iodine. Depending on your diet, if you include a little bit of seaweed, then it's probably not an issue, but it can be an issue for some individuals. And above and beyond that, there's controversy about long chain omega-3 fatty acids, but generally for people with type 2 diabetes, there is a depression in the delta-6 desaturase enzyme, and a lesser ability to convert alpha linolenic acid into EPA and DHA. And so that may be warranted in some of those people. And so that, and in others as well, we still really don't know for sure whether or not it would be an advantage, but generally I think it probably is. So that's another possibility. And
So
certainly
Brenda,
people.
for people who don't know what a long chain fatty acid, omega-3 fatty acid is, how would they get those?
Yeah, so long chain omega-3 fatty acids are made by little plants in the ocean, and fish get them by eating, smaller fish that at one, point along the food chain, they ate those little plants. And so most people in eating omnivorous diets get their EPA and DHA from fish. Now, for people that don't eat fish, like vegans, for example, we rely on the conversion of the omega-3s from plants, and that's called alpha linolenic acid, and you get it from flax seeds and chia seeds and hemp seeds and walnuts. And so we will convert in our bodies to these longer chain, more biologically active omega-3s. These are the omega-3s you need for your brain and your eyes and for your every cell in your body, the cell membranes and so forth. And so they are important. And so if your body's not effectively converting, you may not be getting enough. And so, and it's not always easy to know if your body's effectively converting. So many people believe it makes sense when we take omega-3 supplements, these EPA and DHA, they're actually cultured from these plants in the ocean. And so you don't have to worry about mercury. You don't have to worry about raping the oceans. They're cultured and grown, and then the EPA and DHA extracted. And if you look at from a global perspective, if everybody ate the amount of fish that's recommended, the 2 servings a week or whatever, we wouldn't have any fish left in the ocean. We've got 8 billion people on this planet. So it makes so much more sense to me to culture these little plants and include them in whatever foods we're producing and so forth. But at this point in time, we don't know, we can do a lot to maximize our conversion just by eating a healthy diet, by not eating, excessive omega-6 relative to the omega-3. There's all sorts of things. I've written a lot about this, but there are several, ways we can maximize conversion. But anyway, yeah, at the very least, you want to be eating some flax seeds, hemp seeds, chia seeds, and a little bit of walnuts to get those omega-3s at the very least. But if you do have type 2 diabetes, definitely consider an EPA DHA supplement.
Right. Okay, excellent. Thank you for that. Wow. I think we've come to the end here. Brenda, you are just a wonderful speaker, and I'm so glad we didn't have to usually when I hear you at a conference, you have to squeeze it all into an hour, and then it's time for the next speaker. So this was much more relaxed, and we got to have nice Q&A. So thank you everybody for coming, and thank you to Brenda Davis, thank you Dr. Friedman, and thank you Robert Franke, who's the guy behind the blue ball, who's whom you may or may not be seeing. I see it, but I guess the audience doesn't see it. But he's our engineer tonight, and hopefully we'll see you all in May for Virginia Messina. So good night. Thank you.
Good night.
Thank you so much.
Bye-bye.
Thanks so much for having me.
Thank you.